In a laboratory, the job of the cytotechnologist is to A. Prepare samples of the body tissues for examination. B. Examine body cells to detect and stage cancer. C. Perform general laboratory tests. D. Examine tissues and interpret laboratory results. Following venipuncture with excessive bleeding, a saturated blood-stained gauze should be placed in A. Paper bag. B. Hazardous waste container. C. Bedside waste basket. D. Sharps container. When using a bariatric blood pressure cuff instead of a tourniquet for an obese patient, the blood pressure cuff should be inflated to A. Just above the patient's systolic pressure. B. Just below the patient's systolic pressure. C. Just below the patient's diastolic pressure. A small bench fire occurs in the laboratory. The first step in using the portable fire extinguisher is to A. Pull the pin. B. Hold the extinguisher in an upright position and squeeze the trigger. C. Remove the seal. Which of the following statements is not one of the three major goals of the patient's Bill of Rights? A. Assures that the healthcare system is fair and works to meet patients' needs. B. Gives patients a way to address any problems they may have. C. Ensures that the care you receive is affordable. Which of the following duties is outside the scope of the phlebotomist's practice? A. Collecting a tissue sample. B. Label samples correctly. C. Drawing blood using the appropriate equipment. D. Identifying patients properly. In delivering quality patient care, which of the following actions should be avoided? A. Excessive punctures. B. Repeated draws. C. Probing on their medical condition. D. All of the above. What federal agency regulates phlebotomy certifications? A. Center for Disease Control, CDC. B. National Institutes of Health, NIH. C. Health and Human Services. D. None of the above. If you encounter a hazardous chemical that you need more information about, where can you quickly and accurately locate that information? A. Employee Manual. B. Material Safety Data Sheet, MSDS. C. By searching on the Internet. Being free from contamination or germs is referred to as what term? A. Asepsis. B. Healthy. C. Sepsis. D. Clean. Implied consent from a patient to draw blood would be obtained by which action? A. The patient signs a consent form. B. The patient verifies their identity. C. The patient extends their arm. D. All of the above. When collecting a sample to determine blood alcohol levels, what color tube should be used? A. Yellow. B. Red. C. Royal blue. D. Gray. If a sample needs to be diluted, what should be added? A. Anticoagulant. B. Preservative. C. Diluent. D. All of the above. Potassium EDTA binds to what element in the blood? A. Iron. B. Calcium. C. Magnesium. D. All of the above. If you notice that the name of a patient is spelled differently on the requisition and a patient's armband, what is the best course of action? A. Assume there was a typo and ignore the requisition. B. Visit with your manager to verify the information and have it corrected. C. Ask the patient to go get the requisition corrected. Anchoring a vein properly requires which of the following actions? A. Place your thumb on the side of the vein and press firmly. B. Placing the thumb of your free hand below the vein and stretching the skin. C. Increasing pressure on the tip of the needle. The most common cause of contamination in blood cultures is which of the following? A. Improper site preparation. B. Improper transportation. C. Improper storage. D. All of the above. What is another name for a thrombocyte? A. Platelet. B. Thrombus. C. White blood cells. D. Plasma. Inserting a needle at the point of divergence between veins can result in what? A. An increased chance of a hematoma. B. Nerve damage. C. Failed venipuncture. D. Nothing. This is an ideal spot for venipuncture. Which of the following is a complication that can arise in capillary sampling? A. Collapse of veins. B. Nerve damage. C. Scarring. D. All of the above. Approximately how many liters of blood is generally found in the adult human body? A. 2 liters. B. 3 liters. C. 5 liters. D. 10 liters. Which of the following is a cause for rejection of a specimen? A. Improper specimen, serum, blood, plasma. B. Incomplete chain of custody documentation. C. Insufficient quantity. D. All of the above. A failure to allow alcohol to completely dry during site preparation can lead to what? A. Hemolysis. B. Hemoconcentration. C. Hematoma. D. There is an impact if the alcohol fails to completely dry. A failure to fast when ordered can impact a blood sample in which of the following ways? A. Increasing its turbidity. B. Increasing stress hormones. C. Increasing enzymes such as creatinine and fatty acids. D. A false increase in analytes. The process of maintaining control of a specimen from the point of collection until testing is complete is referred to as what? A. Chain of custody. B. Specimen tracking. C. Patient control. An incident reporting system should include which of the following components? A. Details of the incident. B. Potential causes. C. Management of adverse events. D. All of the above. Which of the following is not required on a correctly completed requisition? A. Patient history. B. Priority status. C. Test ordered. D. Patient number. Which of the following is a national patient safety goals? A. Identify the patient correctly. B. Prevent infection. C. Improve communication. D. All of the above. Workplace safety in a lab is governed by which agency? A. Center for Disease Control, CDC. B. National Institutes of Health, NIH. C. Federal Emergency Management Administration, FEMA. D. Occupational Safety and Health Administration, OSHA. What is the proper sequence for putting on PPE? A. Gloves, gown, mask. B. Mask, gloves, gown. C. Gown, mask, gloves. D. Mask, gown, gloves. When should a sharps container be disposed of? A. After it is half full. B. When it is 3/4 full. C. When it is full. D. Never. They are reusable. Which of the following tests does not require fasting? A. Lipid profile. B. Renal function panel, CRF. C. Iron test, TIBC. D. Complete blood count, CBC. The additive 3.2% sodium citrate results in what? A. The prevention of clotting by binding calcium. B. Activation of clotting with glass or silica particles. C. Prevention of clotting by inhibiting thrombin and thromboplastin. D. Prevention of clotting by inhibiting glycolysis. Venipuncture should not be performed on which of the following sites? A. Sites with scar tissue. B. Sites with hematomas present. C. Sites with vascular grafts. D. All of the above. The use of povidone iodine for site preparation can result in a false increase in what level? A. Potassium. B. Phosphorus. C. Uric acid. D. All of the above. Before drawing from a sleeping patient, what should be done? A. Leave and return later when they are awake. B. Verify their identity on the armband and proceed with the draw. C. Gently wake them up, and when they are ready, request they verify their identity. What type of draw is generally performed for patients in infancy? A. Finger stick. B. Heel stick. C. Venipuncture. D. Arterial. Which of the following would not be required for a finger stick? A. Syringe. B. Gauze. C. Alcohol wipes. D. Micro containers for the requested tests. Which of the following is a characteristic of capillaries? A. They are permeable for every substance. B. They are found in every square inch of the human body. C. Their walls are rugged. D. Capillaries are only a small part of the vascular system. What action can prevent bruises from forming due to a blood draw? A. Applying firm pressure immediately after and keeping a bandage on for several hours. B. Taking ibuprofen. C. Applying heat. Which test order should be given the most priority? A. Stat. B. Urgent. C. Timed. D. Routine. Which of the following is not a primary method of venipuncture? A. Vacuum tube. B. Lancet. C. Syringe. D. Butterfly. Why is blood drawn in a specific order? A. To reduce pain and patient discomfort. B. To avoid cross-contamination of additives. C. To facilitate transportation of the specimens. D. All of the above. When a sample is rejected for QNS, what is the appropriate response? A. Collect another sample while protecting it from light. B. Collect another sample with sufficient quantity. C. Analyze the label for missing information. D. Redraw the blood in the proper order. Which of the following examples is not a HIPAA violation? A. Accessing the health records of family members or friends. B. Providing court-ordered health information. C. Accidentally losing an unencrypted laptop. D. Providing a patient with a copy of requested health records within 60 days. What is the first step in dealing with a patient that appears nervous? A. Discuss the procedure in detail. B. Assess their cause for concern and provide reassurance. C. Double-check with the ordering physician to determine if the draw is truly necessary. Which of the following can reduce your risk of infection after being exposed to a blood-borne pathogen such as hepatitis B or HIV? A. Taking a post-exposure prophylaxis. B. Reporting the incident. C. Discuss the exposure with your physician. What types of safety hazards might you encounter while working as a phlebotomist? A. Biological. B. Electrical. C. Radioactive. D. All of the above. Which of the following can result in legal or criminal actions against the phlebotomist? A. Breach of confidentiality. B. Holding a patient down to obtain a sample. C. Median nerve damage related to a negligent draw. D. All of the above. When a patient's vein is small, thin, or fragile, what would be the most appropriate equipment selection? A. Evacuated tube system. B. Syringe. C. Straight, multi-sample needle. D. Additional bandages. Which of the following needle gauge sizes has the largest bore opening? A. 18G. B. 21G. C. 22G. D. 25G.